Welcome back to We Are Austin. Aging is a natural process, but did you know that your immune system can help determine your biological age? Dr. James LaValle, creator of the Metabolic Code, and Ray Solano, pharmacist, clinical nutritionist, and owner of PDLabs in Cedar Park. They are both here to talk to us today about what determines your biological age and how to get it tested. Good morning, gentlemen.
Good morning.
Good morning.
I'm very intrigued by this topic, and I've done some reading prior to this morning, but when we say testing your biological age, how does that work?
Well, you know, we say that personalized healthcare is the future of medicine, and glycan age is changing the way we measure our age. You know, we know our birth date, but metabolically, how old are we really? You know, and recent scientific breakthroughs have identified unique compounds in our blood called glycans. You know, these are the basic building blocks of life, and they really give a completely different picture about how well our lifestyle choices are. And Jim's an expert in this area, and he's going to explain this more.
Yeah, and I'm looking forward to that. You know, Ray, over the years, as we've gotten to know each other, you know I'm a big fan of that comprehensive look and knowing that each individual is going to be different and what is going to be best for them is going to be different for someone else. So, Jim, how does this pair with your Metabolic Code program?
Well, I mean, it pairs beautifully because, you know, in the end, you know, a lot of us, you know, we get on social media and some trainer or somebody says, oh, you need to fast 16-8. Or, oh, you need to eat only fats and protein. Go ketogenic. No, don't go ketogenic. Go vegan. No, go keto vegan, right? There's so many things that people get bombarded with on how they should live their life and try to be healthy. And, you know, what I've been committed to is let's measure if you're really doing what you need to do to be healthy. I think the glycan test is one of the breakthrough tests because glycans coat every cell in your body. And what happens as you're aging is they get beat up and you start to create more of an inflammatory glycan versus an anti-inflammatory glycan. And aging is really a process known as inflammaging now. That's the term in the literature. So what are we going to do to reduce that inflammatory process going on? We can measure glycans. And then when you do the metabolic code approach, of course, looking at your labs, looking at your quality of life, looking at biometrics and wearable data, where are you at today? How is your system working? Where are the metabolic roadblocks that could be making you start to damage those tissues? Mm-hmm. And so that's why I think the glycan age test is so exciting because it really gives you a stamp on, hey, where's my aging clock right now as it relates to glycans? And there's a couple other aging clocks out there too. This one's just really easy to use and very actionable because you can measure what you're doing and whether or not it's really helping you.
Yeah, and easy to use is important. Like you said, it can be information overload when we try to go online and find information, and then there's that analysis paralysis and we don't know what to do. So let's say that you did measure the things you're talking about. Can you give us an example of a program or an action item you might then implement in your life? What would that look like?
Well, it could be a couple of different things. For one, if you're a woman that's entering menopause or is in menopause, it turns out that as women enter menopause, their anti-inflammatory glycans go away, their pro-inflammatory glycans start to rev up, and it may be that they need something like bioidentical hormone replacement. It could also be something as simple as don't work out so much. There's a lot of people right now that actually are overtraining. Yeah, I train 6 days a week. I go to CrossFit, then I go to Orange Theory, then after that I do yoga, and after that I walk, right? All that, all in one day. And, you really have to be careful about not overdoing today because now we're into that thought of overdoing. And then also you might want to change your diet. Maybe you are, say, fasting 18 hours a day every day, which all the literature really didn't tell you to fast 18 hours a day every day. Mm-hmm. It said twice a week. And so there's some people where, just trying to even adjust their diet, get them to train maybe a little less could mean that they're actually being easier on their body and reversing that aging clock. And of course, people that aren't moving at all and not making any kind of good choices with their food, maybe they would need to make those kind of choices to improve their movement, improve the way they're eating in order to reduce that aging clock. And then, of course, using nutrients to help you to sleep better at night, maybe to manage stress better. All those types of interventions all could have a dramatic impact on how you're aging. And not just that, most importantly, how great you're feeling. Because in the end, that's what really counts.
Such valuable advice and very congruent with the way I feel about things too. Like you said, the way you feel, that's what makes the difference. It's not the number on a piece of paper. It's when you get up in the morning, what is your zest for life? And so if you are healthy, you can really get that in control. Two other things I really like that you mentioned: balance. It's not so much go, 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 finding that balance and lifestyle choices, because those are things that people can really change. It doesn't feel like such a mountain to climb. It's like little tweaks in your lifestyle and then noticing very impactful results. So thanks for sharing that with us. Ray, is there anything you want to comment on?
We are a specialty compounding pharmacy. We work on making unique compounds and programs for patients. We practice prevention medicine, and that's what Jim is talking about, taking those steps to make those lifestyle changes to get your body as best as you can do. And, start out today, do something different, and go to our website, PDLabsRx.com. has got a treasure trove of free information and resources. We want people to be educated about their health care, because, we say you have a choice in your health care, so start today.
I just love that. Start today. Make today count. Gentlemen, it's been a pleasure being with you. Thank you, Dr. LaValle and Ray. As always, we appreciate your time. We'll talk to y'all soon.
Thank you.
Hey.